Good evening, ma'am. Thank
Good
you for joining us. We'll be starting the webinar in another few minutes.
Sure.
We'll start now. Good evening and a warm welcome from Krista team. Krista is the mother and child healthcare brand of Redcliffe Life Sciences. It is a complete online reproductive health platform providing all services for fertility and pregnancy. I am Shinka Arora and I will be the moderator for today. Today we have with us Dr. Vaishali Sharma, MD AIMS, DSAID Germany, who is a renowned gynecologist, infertility specialist and laparoscopic surgeon with over 14 years of experience. She has recently been facilitated with 2 national awards by Economic Times Health World at National Fertility Conclave in 2019. She has also won National Gold for Budding IVF Specialist of the Year and National Silver for Hall of Fame Endoscopic Surgeon of the Year. Dr. Vaishali has been facilitated with an award as the most promising obstetrician and gynecologist in North India at Global Healthcare Excellence Awards GHEA 2017. I welcome you, ma'am. In this webinar, Dr. Vaishali Sharma will talk on infertility solutions from diagnosis to conception. Over to you, ma'am. Thank you for joining us today.
Thank you, Shinka, for such an elaborate introduction. Thanks a lot. It's my pleasure to be here, and infertility is very close to my heart. Nowadays, many people are visiting. Every day, we are seeing couples who are facing some one or another difficulty in conceiving. So it's my pleasure that I am able to present a talk on this infertility from diagnosis to conception. So I'll be sharing my screen with you. Yeah, so today we will be talking about infertility solutions, discussing all the causes and what are the options that we have nowadays and what are the success rates. So we all know motherhood is a divinity. Every couple they aspire for pregnancy after a few years of marriage, and many of them they face difficulty while conceiving. Whenever they start trying, they face that they are not able to conceive. So first, most important question that many of them they come and they ask to us is when is the fertile period, or when to try for a pregnancy, because nowadays in such a busy lifestyle everybody has a very hectic schedule, so it is very difficult for the couples to manage work, home, everything, to balance everything. So fertile period, it helps such couples in conceiving and planning their day. And so there are many ways that we nowadays have for our regarding fertile period. By this we can know when is ovulation day accurately. So earlier we used to have a calendar, and the people they used to calculate the day of the ovulation. If a female has a cycle of 28 days, then in such case ovulation takes place usually on the 14th day of the cycle. But this day is quite variable. If the cycle is longer, then this day may be shifted to 16th or the 18th day. And if the cycle is shorter, then this day may be preponed to 10th or the 12th day. So we have to know the exact length of the cycle. And once egg is released in the female body, it is available for fertilization for 12 to 24 hours. Similarly, once a sperm enters into the female reproductive system, it is available for fertilization, or it stays alive for 3 to 5 days after the release. So, accordingly, this is the duration which is important if a couple is trying for pregnancy. And there are many methods nowadays which help us to know what is the exact ovulation day or what is the exact fertile period for that particular couple. As I already told you, calendar. Second is nowadays many mobile apps are available. Many women are using these apps which tell quite accurately the appropriate approximate fertile period of in that particular cycle. So those are quite accurate. Otherwise, we have some urine tests which can be done at home only. There are many strips which are available in the market. Ovulation strips are there. These can be used to find out the accurate fertile period. Otherwise, if none of these methods they are helping, then the third step would be to go for an ultrasound. In this, a transvaginal ultrasound is done, which for a follicular growth, it gives us the accurate measurement of the egg which is growing, and also the day of the ovulation, and also has the ovulation occurred or not. For this, we need serial ultrasounds to be done. Usually, they need to undergo an ultrasound starting from the day 9 of the cycle. Alternate day ultrasounds are okay, and usually by day 14th or day 16th, we can see that egg has matured and egg has ovulated. So this way they can plan, and next 2 to 3 days after the ovulation are the most fertile ones. So this is a calendar. If a female is getting periods on the third of a month, then that is counted as day one of that particular menstrual cycle. So if we start from that day, this is day one, then the day 14th would be her ovulation day if a cycle is of 28 days. But yeah, if her cycle is a bit smaller, then she needs to calculate it accordingly. And there are many apps for that also. So these things they can help in finding out the particular ovulation day. The couple needs to stay together around that ovulation day, maybe one day prior or one day after. Those 2 3 days 5 days are the most fertile ones, which will help in conceiving a pregnancy. Similarly, this is how to use the ovulation kit. This also helps us in telling the particular ovulation period or the fertile period. If a female has a cycle of 28 days, then they should start using this strip from the day 9 of the cycle. Similarly, if the cycle is shorter, like 21, 24, 25 days, then she should start using this strip 2 to 3 days prior, maybe on 6th, 7th, 8th day of the cycle. And after that, they have to use it daily, because initially there is one line, only one line is visible, and gradually a second faint line starts appearing sometimes. But the day when the second line is as dark as the first line, it implies that the ovulation is just impending. Ovulation will occur in another 12 to 24 hours, sort of. So they are most fertile in next 2 to 3 days. So it is always recommended to stay together during that particular period if they are trying for a pregnancy. These are various ovulation kits which are available in market nowadays. This is a very common ones which are, they can buy it online, they can buy it through a chemist. So these can be used on their own. So now the most important question is when to meet a doctor, because many times people, they become panicky just after 2 to 3 months. They have been trying, they are not able to conceive, they are really distressed, they visit a doctor, and unnecessary and unwanted investigations are being done. So I just want to make it clear that they should try for a pregnancy at least for a year, until and unless there is any high risk like PCOD, fibroid, or endometriosis, or tuberculosis. Until and unless there is any such history, if the couple is absolutely normal in their 20s, and they don't have any other problem or any medical condition, then they should at least try for 1 year, and then they should visit a doctor. If the cycles are regular, if they are able to stay together, there is no other problem, then this is very important, because sometimes somebody may need more than few months to conceive. It's not like that they will start trying for pregnancy in 1 month or 2 months they should conceive. It's not like that. Even if you are using an ovulation kit, I would definitely recommend that at least try for 6 months. Similarly, if somebody is more than 35 years, then it is always advisable to not to waste any time and consult a doctor, just if they have been trying for 6 months or more. In people who have a history of ovarian cysts and they have been operated for a cyst, then it is definitely recommended, because this cyst surgery can reduce the ovarian reserve, the number of eggs, and they should be investigated, and then they should be decided that they try naturally, or they should be put on some medicines. So in these cases, if somebody has irregular menstrual cycles, if they have PCOD, or if they have fibroid or endometriosis, or any history of tuberculosis for which they have received medicines for maybe 6 months or 9 months, in such cases, they should visit the doctor without wasting any time. Coming to basic tests that we usually do for an infertile couple are: one is a blood test. It is very commonly done. These are the hormones which usually we do on the second day of the period: FSH, LH, estradiol. This AMH and TSH, these are not related to the cycle. These can be done on any day of the cycle, and all these tests, they help us to know if there is any abnormality in the hormones, what is the quality of the eggs, quantity of the eggs. Thyroid abnormality sometimes is the sole reason for inability to conceive. If we correct that thyroid abnormality just by medicine, many couples, they conceive naturally in another 1 or 2 cycles only. Second is the ultrasound. It is a very basic testing. It is a non-invasive testing. It should be done. Specifically, we do it on day 2 or day 21. This way, we are able to know what is the number of the eggs, how many eggs are there, which are visible in the ovaries. And also, it tells us what is the thickness of the uterine lining, which is important for implantation of the embryo. Otherwise, regular follicular monitoring can also be done. So these are basic things which can be done depending on a particular couple's profile. The third is definitely the semen analysis. We need to test both husband and wife. So these were the wife's test, and husband needs to undergo a semen analysis test after 3 to 5 days of abstinence. And this analysis tells us what is the number of the sperms, what is the count, how much is a good morphology, what is the motility. There are many other parameters which we will be discussing in detail in next few slides. Yeah. So once the basic testing has been done and we found out some that nothing is wrong, and we can either tell them that they can try again naturally for another 2-3 months or so. But if we feel that though they have tried quite long and they are not able to conceive and all the basic testings are normal, then in such cases we usually advise them to undergo a test for checking the tubal blockage. As we all know, tubes are the fallopian tubes are there in the uterus, which in which the egg which is released from the ovary, it is captured, and the sperm and the egg, they meet in the tubes only. So if somebody has a tubal blockage, then it is very difficult for them to conceive naturally. And we can come to know about this tubal blockage. There are many tests which are available: HSG, SSG, laparoscopy. All these are invasive tests, so hospital stay is required for them. HSG and SSG are very small duration test. Hardly a hospital stay of 1 hour is required for both of them. There are no stitches in these. Slight pain is there. Only difference in HSG and SSG is that in HSG, X-rays are used, and we get a film and we get the report that yeah, the tubes are visible or not, and we can delineate both the tubes separately. In SSG, we can just check if the tubes are open or not. In this, we use the ultrasound to find out if there is passage of fluid through the tubes or not. The tubes are not delineated as clearly as in HSG, but both are okay tests. There is slight pain, the patient can undergo these tests. But if some abnormality is being found on HSG or SSG, then the next thing to be done is laparoscopy. For this, a hospital stay of minimum 6 hours is required. There are no, we don't take as such stitches in this. There are small, this is a keyhole surgery basically. And nowadays we are using glue in this. There are no stitches, yeah, but small, very small scar marks may be there, 4 mm, 5 mm, not more than that. And absolutely there is no pain as it is done under general anesthesia, and patient doesn't feel anything during the procedure. The advantage of undergoing laparoscopy is that in this procedure we can diagnose the tubal blockage, and in the same sitting we can correct if tubal blockage is there. So this way it helps us in both the diagnosis and the treatment of the tubal blockage. Now, coming to semen parameters, in this semen, we for most important is definitely the count. It should be more than 15 million per ml, and then is the motility. We all know that we need the sperms to be motile. If more than 40% of the sperms are motile, then it is quite good. The couple should be able to conceive naturally with that. Other one factor that is usually most of the people, they don't give much importance to morphology. Many times a couple comes to me who have been trying naturally, even though they are carrying a report of teratozoospermia. Basically, morphology is that the total number of normal looking sperms, basically how do they look. So ideally we need that it should be more than 4%. If the abnormal sperms are there and normal sperms are less than 4%, then definitely it is a problem. And we may have to go for IUI or IVF in such cases, because it is difficult. Majority of the times it is difficult that morphology will improve with the medicines. But yeah, we may definitely try, but we should not waste time if the morphology is such poor. Many times couples, they are advised medicines and they keep on trying there with injections and other sort of things, but this thing is also an important parameter which is mostly overlooked. Pus cells is also one another factor. Ideally there should not be any pus cells. It means that there is some infection if pus cells are being seen in the semen. So in such cases, we get a semen culture done, and antibiotics are advised accordingly depending upon the infection and its sensitivity. So these are the important factors, parameters of the semen, which are important for conceiving naturally. So similarly, now when we find out that this is the reason, what is the cause of infertility in a particular couple, we advise them a customized treatment protocol which is specific for them. The treatment option will be definitely different in PCOS and poor ovarian reserve. In tubal blockage, the treatment options will be absolutely different. Similarly, in semen abnormality, the cause is, if the semen problem abnormality is a problem, then we need to treat it completely differently. And similarly, if the unexplained infertility is there, that means all the tests have been found to be normal, and even then the couple is not able to achieve pregnancy naturally. So in such cases, sometimes if they have been trying just for 1 year, usually we advise them to try again naturally for at least for 6 months or more, so that we can give them sufficient time. But if a couple has been trying naturally for more than 2 years and they have been found to be unexplained infertility, then I would definitely suggest them to undergo some further testing and some further treatment options which are available with us. So, if you look at the PCOS patients, PCOS we all know as the polycystic ovarian syndrome. Nowadays, it is becoming very common. The treatment options that are available with us are one, start with, it is with exercise, diet, lifestyle changes, weight reduction. All these things, they play a very important role in PCOS management, because the problem in this is, it's not that there are no eggs, there are many eggs. In fact, the problem is that there are too many eggs are there, but none of them is growing or none of them is ovulating every month. So the concerned person may have a irregular cycle, they may not be having their regular periods, or they may be having other problems associated with it, like acne and unwanted hair growth. So if a female has a problem of PCOS, then we have many options with us, and those are they have very good success rate. There are many medicines which help in inducing ovulation in such patients. If medicines are not working, then we have injections. If injections are also not working, then we can go for laparoscopic ovarian drilling. All these things, they have a very good success rate in PCOS. So nothing to worry as such for PCOS. The chances are very good for pregnancy, even for spontaneous conception. Even if the normal pregnancy is not occurring, then they can go for IUI, or IVF is the last solution. Okay, and then there is this metformin. Uh, then there is this tablet where we can give medicine for it decreases the resistance of the body, and then it has a very important role in uh, PCOS patients. Uh, just a minute, there is some problem in this. Can I just stop it for a while?
Sure, ma'am.
Priyanka,
Do you want me to change or
yeah, I'll just change it and then I'll let you know. Yeah, just a minute. Yeah, Shrinka, can you hear me now?
yes, ma'am.
Ah, so sorry for the interruption. So the thing is that in PCOS we have so many options. Then we can go for in the cases like where the AMH is low, it is completely different from PCOS. It is in fact opposite to PCOS. Here, the treatment options are many medicines are there, PRP solution installation is there, even injections are available which may help in such cases. The problem here is that the number of eggs are a bit less in the ovaries. Okay, so we have to find out if we can get these eggs, what is the quality of these eggs. So we can give medicines which can improve the egg quality and quantity, or we can give injections to get these eggs. And we may have to undergo advise patient to go for IVF in such cases. But in these patients, we have to advise them individualized stimulation protocols. We have to use growth hormone, testosterone gel. Many things are available for such couples who are having the problem of low AMH. In many cycles, we may go for pooling of the oocytes, and in case if we are able to get only a few number of embryos, then we can go for PGS also for selecting the euploid blastocyst. Otherwise, the last option is definitely IVF with the donor egg. These have very good results in such cases if we are not able to retrieve good quality egg from such couples. These are the medicines which are available to improve the egg quality and quantity. One is the DHEA. This is a molecule is available in market. Then leucine is there, valine is there, vitamin D3, melatonin, coenzyme Q10. All these molecules have been found to improve the quality of the eggs, and in this way we can increase the number of eggs that we are able to retrieve in our IVF cycles. So those were the treatment options for low AMH. Now coming to treatment options for blocked tubes, we have laparoscopic correction. Tuboplasty is there. By this we do the laparoscopy, and in case there is some blockage over here or mid segment or fembral blockage, then these blockages can be corrected laparoscopically. If the blockage is near the cornua at these places, then we may have to correct it hysteroscopically. We put in a camera inside through this, and we can open the tube through this opening. But if we need to be assured that rest of the tube is completely patent. If in cases where the tubes are damaged to a greater extent and we are not able to correct it laparoscopically or hysteroscopically, then we have to plan IVF cycle for such couple in such cases, and it has a very good result for these IVF cycles for the couples who have tubal blockage. Only the cause is tubal blockage, and IVF has a very good result in such couples. Coming to treatment options for abnormal semen parameters, we have many medicines which are available. These are basically multivitamins and antioxidants, which are good for improving the semen motility and count in some cases. In the patients where the problem is majorly the low hormones, then we can advise them some injections also, which help in improving the semen parameters. In cases we are not able to improve it much, then we can advise them to undergo IUI. For this, we need a basic minimum of 10 million sort of counts. If the sperm count is more than 10 million, then we can definitely go for IUI. It helps in improving the motility. And in cases where the number of sperms is very less than 10 million or less than 5 million sort of, then we can advise them to go for IVF with ICSI. ICSI is a procedure where we advise, we take the sperms and we deliberately inject each sperm into 1 egg, and this way embryos are formed. Nowadays, we have many other technologies, very other techniques which are available, ICSI and MAX, which help us in selecting the good quality sperm so that a good embryo is formed and we can get a successful pregnancy result. In the cases where the number of sperms is absolutely zero in the semen count, that is azoospermia, then we need to advise them some further tests, ultrasound, scrotum, and other things, which help us in telling if the sperm formation is being there occurring inside the testis or not. So if this sperm formation or the sperms are present inside the testes and they are not able to come outside due to some blockage, then we can advise them to undergo TISA and micro TISA, depending upon what is the concentration of sperms inside the testes. So these techniques, they have helped us in achieving pregnancy in couples with severe semen abnormalities, and they are really very good in achieving results when the majority of the times when the other people were advising them to go for a donor semen. So these techniques, they help in achieving pregnancy with their own sperms. So these things are really helpful in getting a positive result. This is a video of ICSI. Here this ovum egg is being held, and we just inject this egg with a sperm inside it. These are the other techniques, Pixie and Max. These help us in selecting a good quality sperm. So these are needed for severe male factor infertility. If now once the embryos are formed and we know that embryos are there, eggs are there, sperms are there, even then if the pregnancy is not occurring, then the next thing is to check what is the condition of the uterus and the uterine lining. We need a very good endometrial picture. Usually we need a thickness, it should be more than 6 or 7 mm at least, and the pattern should be like this triple lining. If it is being visible, then it shows that yeah, the uterine lining is good, there is nothing wrong with the uterus. In case the thickness is less or the pattern is different, it is hyperechoic, or if the blood flow is not there, if we can see calcifications inside the cavity, then these are other causes of the infertility and we have to tackle them accordingly. It can be because of adenomyosis, there may be polyps inside the uterus, there may be fibroids. So these are the things which may be responsible for difficulty in conceiving or even for the failed IVF cycle. These can be the reasons which may be hampering the implantation in such cases. So this is a picture of blood flow in the uterus. We can see blood flow is available here till here. So we can decide which zone blood flow is there. It should be there for a good implantation to occur. So coming to the treatment options for fibroids, if somebody has fibroids, then we need to very accurately see what is the location of the fibroid, what is the size of the fibroid. The treatment for all the fibroids is not the same. Many a times if the fibroids are small, like 2 or 3 centimeter only, and they are away from the cavity, they are not protruding or indenting into the cavity, then majority of the times no treatment is needed for fibroids, and we usually advise them to try naturally. And only if the fibroid is a bit bigger, like 5 centimeter or more, or if it is indenting into the cavity, it is pressing the cavity, then only we usually advise them to go for removal of fibroid. The surgery is known as myomectomy. It can be done laparoscopically or it can be done hysteroscopically. Laparoscopically is basically the surgery where we put in a camera through the tummy and we remove any fibroid which is present on the surface of the uterus or which is visible through the surface of the uterus. So in this some small scars are there. Hysteroscopy is a surgery where we put in a camera through the vagina here, and if any fibroid which is present here in the cavity, which will definitely will not be visible from here, we can remove it through the camera, looking at it, and we can remove it. So this is hysteroscopic myomectomy. So for fibroids, a very accurate diagnosis and very accurate correction is absolutely needed, because unnecessary treatment in turn may hamper the pregnancy instead of helping it. So we have to be very cautious while we are tackling fibroids with infertility. We have to decide it very cautiously. Sometimes we may just need some medicines or injections which may help in just shrinking the size of the fibroid and just helping the pregnancy. So surgery is usually always not recommended in a couple who is trying for a pregnancy and has a fibroid. It has to be very cautiously decided what is the size, what is the location. We go for fibroid mapping and then only we decide how to proceed further for that particular couple. So these are our some patient success stories. Here a couple came to us in which the female partner has the AMH of zero point 0.6. It was very low. She was just 37 years of age and they had an infertility for 4 years. So we advise them, because many of the doctors advise them to go for IVF with a donor egg, and she was actually not ready at all for a donor egg, definitely. So we proceeded with IVF with antagonist protocol after 3 months course of these medicines, which helped in improving her egg quality and quantity. And then when we went for the retrieval of eggs, we could get 8 eggs, and fortunately, we could make 4 blastocysts. And she conceived in the very first transfer in a freeze-all cycle, and she could able to conceive with her own egg with such a low AMH. So Similarly, nowadays many people are coming to us with low AMH because it is being done quite frequently in all the couples. This was a very young girl, 24 years, and she was found to have a very low AMH of zero point 0.5 nanogram per day. And she had a primary infertility for 3 years. She was trying for pregnancy for last 3 years. She must have been married at the age of 21, and she was not able to conceive naturally. Again, she was also not willing for IVF with donor eggs. So we stimulated her after giving her testosterone gel, which also helps us in improving the quality of the eggs. Though we could retrieve only 4 eggs in her case, but the blastocysts were formed in two of them, and we could get a positive pregnancy result in very first cycle of IVF with her own eggs. So, similarly, again, this was a couple where the female partner was 41 years old and they were married for 6 years. They already had a child, but they were trying for last 2 years for another pregnancy, but they were not being able to conceive. And when she underwent some tests, she was found to have a AMH of zero point 0.9 nanogram, and because her FSH was okay, and when I did her ultrasound, I could see the number of eggs were there. So instead of advising her IVF, I advised her to first go for ovulation induction with hormones, though I had to give her a bit higher dose of hormone. But she conceived in the very first cycle of ovulation induction with IUI, even after being 41 years of age. Many of the other clinics were advising her to undergo IVF, and that too with donor eggs. So she was not ready at all, and she didn't want to undergo IVF also because she already had one kid. So this way, looking at her previous reproductive history and looking at her all other hormones reports and ultrasound reports, we advised her ovulation induction with IUI, and fortunately, she conceived in the very first cycle. So these are the some success stories which tell us that IVF is not needed in all the cases. We have to see what is a particular patient profile, and we can decide the treatment protocol according to that. Similarly, this was a 36-year-old female in which there was a history of surgery for ovarian cyst. As I told you earlier, the surgery for ovarian cyst is has a very negative effect on the number of the eggs. So her AMH when was done, it was found to be very low, zero point 0.3, and she was very keen for her own eggs. So we advised her to undergo IVF with antagonist protocol with growth hormone supplementation. We could get just one egg in such case with at such a low AMH, and luckily only one blastocyst was formed because the quality was good. She was not just 36, and the cause of her low number of eggs was the surgery, not some inherent problem in the ovary. So the one egg that we got, we could make one blastocyst out of it, and she got a positive pregnancy result just after this transfer. So these are the things, these are the cases which tells us that we can definitely get good results, but we have to tackle to the problem of that particular patient. We cannot generalize it that we should do this in all of them. It's not like that. We have to customize the protocol. Like in this couple, their female partner was just 25 years and her AMH was 0.7%. Again, it was less than 1, and she was advised to undergo IVF with donor. Majority of the couples, they come to us with this recommendation only. They are referred to us for IVF cycle with donor egg, and many of them nowadays, they are educated, they are working women, they are not ready to undergo a donor cycle, obviously. So we customize the IVF protocol, or we advise them what to do according to their particular profile. Like in her case, since her FSH other hormones were in normal range, and her age was also in her 20s, so we decided to go with the ovulation induction with the hormones. And uh, this thing, see, she conceived in second cycle of ovulation induction. Though we had one failure cycle of ovulation induction, but she could conceive in the second cycle. We could see that her eggs are being formed, these are being released. So we continued with the same protocol in the second cycle, and luckily she conceived in the next immediate cycle. Again, this was one more patient. She was 41 years of old age, and she was married just for 3 months. So she was not willing for anything at all. She didn't want to undergo IVF or anything. She was referred to us for undergoing IVF with donor eggs because her AMH was zero point 0.6, her age was 41. We, looking at her particular history, as she was just married for 3 months, I did an ultrasound, and in ultrasound, the number of eggs were there. So we decided to put her on medicines which will improve the quality and the quantity of eggs. And she conceived spontaneously just after 2 months of this medical treatment only. Nothing else was needed, no injections, no ovulation induction, no IUI or IVF. And she conceived naturally at the age of 41 just by medicines. So these are the things that we have to we have to tackle the particular couple, we have to look at their problem, and then we have to advise them treatment which are specific for them. We cannot just generalize a treatment for everybody. Similarly, this was also a patient. She was 33 years old. She was also referred to us for IVF, and as her AMH was such low, 0.12, but her other hormones were also very low, very almost in the normal this range. So, and she had a secondary infertility. That means she conceived 6 months back, but unfortunately, her child didn't survive some due to some mishap. So, looking at her this reproductive history that she could conceive 6 months back only, so we decided to put her on in medicines for improving her AMH value. And see, again, she conceived spontaneously just after 2 months of medicines. So these are the things which help us, which tells us that yeah, our idea of looking at the problem of a couple in a specific way and treating them specifically instead of just giving them general recommendation that this should be done at this AMH. It's not like that. We have to see all the aspects. We have to see all the reports. We have to listen. We have to see what was their history. So all these things, they help us in making a correct decision regarding the protocol that should be followed in such a particular couple. This is a list of our IVF patients which we have done in last few months. So this way we can see almost 90% of the couples, they got a positive result. It was just because we followed a customized protocol for a particular couple. We don't follow a generalized protocol for everybody. We look at the particular problem and then we treat it accordingly. Thank you, and thank you for your patience listening. Yeah, hi Shrinka, can you hear
Hi,
me?
ma'am. Thank you so much for a wonderful presentation. I'm sure all the success stories give a lot of hope to the people and the couples who are really trying to have a baby.
Yeah.
Thank you so much. Ma'am, we have a lot of questions for you. I guess I'll start with the questions.
Yeah, sure, go ahead.
Yeah. So the first question that we have is, can the metabolic syndrome caused by PCOS go away with treatment?
Yeah, PCOS is such a responsive. This thing is that it is majorly, it is a lifestyle disease. This is not a disease which is caused by a virus or a bacteria. It is a lifestyle disease. If somebody is maintaining an optimum weight, they are taking a good diet with fruits and vegetables and salads, and they are doing a regular exercise, maintaining their BMR, maintaining their optimum weight, and this metabolic syndrome can be corrected if they are in the correct range of weight. In fact, no medicine is needed for such a patient.
Okay, ma'am. Moving on, another question by Miss Batra we have, is there anything which we need to skip in our meal, like chicken, eggs, etc.? And is there anything which we need to add in our meal while conceiving? So basically, she's asking about the optimum diet.
Okay. Yeah. See, regarding diet, I would say it is always good to avoid whatever things which are harmful for health in general. See, alcohol, smoking, all these things are have very negative effect on even on the eggs, even on developing embryo. So these things have to be avoided definitely. And regarding diet, it would be good if she can avoid papaya, pineapple, chiku, Chinese food containing ajinomoto, or I would say anything containing too much of preservative. It is always good to have fresh fruit, fresh vegetables, and homemade, home cooked food, which help us in having a normal health. Generalized health is also good with all those things. So these are good for pregnancy also. But certain things have a very negative effect on pregnancy. One is the alcohol, second is the smoking, and third I would say is just the dietary changes that I said, Ajinomoto, papaya, those sort of
Yes. Okay, and I think even the medicines they should take only when prescribed.
Yeah, definitely. Medicines should be taken only after prescription from a doctor if they are trying for a pregnancy. Also, X-rays have to be avoided in case they have to undergo X-ray for anything. And if they are pregnant, they should avoid undergoing X-ray without telling the doctor. And MRI can be done in such cases. MRI is safe in pregnancy. X-rays and CT scans are have a negative effect on pregnancy.
Okay, that's true, definitely. Then we have another question by Ms. Naram. Does a retroverted uterus cause any problem in conceiving a pregnancy?
Uh, no, as such, retroverted uterus doesn't cause any problem. If all other factors are there, ovaries, eggs are okay, semen counts are okay, tubes are patent, then retroverted uterus, I don't think it would cause any problem in that.
Okay. Another question, ma'am. A lady is 32 years old and has an ovarian cyst surgery last month. When can she plan for the pregnancy? I think you've answered this in your slide as well. If you could briefly touch upon it again.
Yeah, yeah. If she has undergone a surgery for ovarian cyst, then I would say she should try for surgery. It has already been 6 months. She should immediately start trying for a pregnancy. She should not waste any time further after that.
Okay. And one another question that we have: what is insulin resistance and how does it affect PCOS?
Yeah, insulin resistance is basically the resistance of our body, and it is responsible for weight gain and abnormalities in the this menstrual irregularities, menstrual cycles are abnormal. So this insulin resistance is directly related to weight. If a person is having or maintaining an optimum weight, then her insulin resistance will definitely come down. Otherwise, if everything is okay, she's lean and thin, and her insulin resistance is coming even then higher, then we have medicines also, metformin, and many other medicines are there which can help us in reducing the insulin resistance.
Okay, ma'am. Another question. A lady is suffering from PCOD since 6 to 7 years. Without medication, her periods do not start naturally. And now she is married and planning for a baby. So, can that be done? What can be done for the same problem?
For her, I would definitely say that if she had already tried for pregnancy for 6 months or more and she has not conceived, then I would say better to consult a doctor. We can give her oral tablets, which will help us in making good quality eggs in her case and evolution. And there are many other options also. If medicines will not help, then we can go for injections and other supportive medicines. So she should definitely consult a doctor because as she is not getting period without medicine, that means there is serious problem with the formation of egg and the evolution. So she should definitely visit without wasting any time.
Okay. We have another question by Mrs. Salima. My husband is having my mild cyst in seminal vesicles. So, is it curable with the medicine and sperm quality is low? So, what is the best step that I can take? Her reports are normal.
See, if her reports are normal, and it depends on what kind of semen abnormality is there. Means if semen counts and these things are okay, then she should conceive. Otherwise, I would say that she may go for IUI. And regarding the seminal vesicle cyst, I suppose urologist will be the best person to tell if they want to treat it or not. But regarding fertility, I can definitely say we can advise her to go for IUI. It is a very non-invasive sort of a procedure in which we take the semen, the partner gives the semen at the clinic, then we wash it, we make it a concentrate, and we put it inside the lady's uterus with a small tubing. It is painless procedure, and it helps in delivering a concentrated, good quality semen into the uterus so that sperms are available for fertilization. So the seminal vesicle cyst treatment can be done side by side, but I would definitely suggest her to undergo IUI or go for semen freezing at least before going for any surgery, because semen is very dynamic sort of a thing. You cannot predict if it will improve or if it will deteriorate. So
Okay,
if we have semen sperms in the semen right now, better to go for IUI.
okay, ma'am. We have another question. With ultrasound scanning for egg counting, will it harm the uterus or any other?
No, no, no. Ultrasound doesn't cause any problem. Ultrasound
Hmm.
has now, we have been doing ultrasound for last almost 3 decades, and ultrasound is completely safe for eggs, for uterus, for baby. Even if ultrasound is being done during pregnancy, it is completely safe. Nothing to worry about it. I already told you we have to worry about X-rays, CT scan. These two are very dangerous for baby. Ultrasound and MRI, these are completely safe.
Okay, and ma'am, we have another question by Miss Shrestha. If an unmarried woman is diagnosed with ovarian cancer in her late 20s and has gone for bilateral salpingo-oophorectomy, I think I've pronounced it fine, and hysterectomy, except surrogacy and adaptation, is there any possibility on the leftover options pertaining to conception?
Oh, if she has already undergone salpingo-oophorectomy with hysterectomy, then the option for her right now, I don't think when she was diagnosed, then there was an option of egg freezing. But if the eggs were not frozen and kept at that time, that means we don't have her eggs right now. So only thing that can be done for her right now is the uterine transplantation. We can take a uterus from some other lady and we can transplant it in her body, and then she can go for IVF with donor eggs.
Okay,
Definitely, we don't have her eggs, so obviously we cannot make embryo using her eggs. But yeah, if she really wants that she wants to carry a pregnancy, then the only option will be uterine transplant. But I would say uterine transplant itself is a very tedious procedure. She has already undergone a surgery for ovarian cancer. So it's her choice. It's a personal choice if she wants to opt for a uterine transplant or she wants to opt for surrogacy.
okay. So we have another question. What is the difference between ovulation induction and ovarian stimulation?
Oh, actually, these induction is basically we are giving medicines to make egg, maybe one or two. We are inducing the formation of eggs in which the eggs are not being formed. Ovarian stimulation is used in IVF where we stimulate ovary which is already making one egg as such, but we are stimulating it to make a more number of eggs, maybe
Okay,
10, 12, or 15 for an IVF cycle. So
okay,
the hormones are same, but the dosage is more in ovarian stimulation, and it is done in IVF. Ovulation induction is done in cases of PCOS.
okay. And a second part of the same question that the person wants to ask is there any increased risk of gynecological cancers like in ovarian stimulation?
Yeah, definitely. There is a slightly higher risk of ovarian cancer if a lady is undergoing ovarian stimulation. But again, we have to always weigh the benefits and the risks associated. If she has to undergo an IVF cycle and she wants to conceive and IVF is the only option for her, then I would definitely tell that yeah, she can undergo a procedure of ovarian stimulation considering its benefit over a slight risk of ovarian cancer later on.
Okay. And ma'am, another question we have that how successful is a uterine transplant?
Uterine transplant, actually it's a very recently developed technique. I suppose first uterine transplant was done in India almost 3 4 years back only. So it's a very recent technique, and we are doing it. It's not being done very frequently. It's like other any other transplant only, like kidney transplant, liver transplant. But yeah, for those we don't have any other option. But for uterine transplant, the other option is surrogacy. So it is the choice of the particular patient. What does she want? She actually wants to carry a pregnancy for 9 months, or she just wants a baby at the end of the. pregnancy. So that is her personal choice.
Okay. We have another question, ma'am. Does PCOS affect FET or failed implantation?
PCOS usually will not affect the failed implantation usually, because in PCOS the major complaint is the formation of the egg. If it is taken care, and her, if she is overweight, then there may be some other reason. Her sugars may be the problem, other things may be the problem. But PCOS usually doesn't cause any problem in implantation. It causes problem in ovulation and egg. Basically, it is the problem with the eggs. It hardly causes any problem with that. So in PCOS patient, the success rate of IVF is much higher compared to the other patients in which the problem is with the uterus instead of with the eggs.
Yes. And we have another question, ma'am. What can be done for high LH and anovulation in a lady?
For high LH and anovulation is basically PCOS only. So we have medicines which will help in making eggs, and once the egg is ready, we can see it in ultrasound. We give a trigger shot which will help in ovulation, and this thing will be taken care of with the injections. It is very easily treatable nowadays.
Okay. And I think this is the last question that we have. If a male who's 32 has zero sperm count, should they have to go for an IVF, or is there any other chance to treat this and conceive naturally?
See, if there is no sperm at all in the semen, then there is no chance of conceiving naturally, I would say. It is always good to undergo investigation to find out if the reason for absence of sperms is either the blockage in the tubing, the duct in the male, or if there is inherent problem with the formation of sperms. So if sperms are being formed inside testes, then there is a very good chance of conceiving with IVF along with TISA. TISA is a procedure where we take out the sperms which are present inside the testes, but they are not being able to come outside in the semen. So, such a couple should undergo with IVF with TISA. But if in cases where the sperms are not being formed even inside the testes, there are no sperms at all, that we can come to know after FNAC. Then in such cases, the only option would be to undergo use the semen, donor semen, which is we use in our lab. So we have to find out what is the cause of absence of sperms in the semen.
Okay. Thank you so much, ma'am, for such a wonderful presentation. I think we are still having a lot of incoming questions, but I think whosoever wants to ask more, please, I've given the website and I've given a contact number. Please call us on that. Thank you, ma'am. If there are no other questions, then we'll wrap up the webinar for today. Thank you so much, ma'am, for taking out time to enlighten us so much. A lot of people in the chat box also are saying, that it was a very insightful presentation with a lot of valuable information.
Thank you, Shrinka. Thank you. You also had a very good quality of questions that you had, but yeah, I also felt very satisfied at my end that I could be resolve some queries. Thank you.
Thank you so much, ma'am. Thank you. Please stay tuned in for the upcoming webinars. Thank you, everyone, for your participation today. Thank you, ma'am.
Thank you, Shrinka. Bye.